Our next speaker is Dr. Sujit Chatterjee. He will be speaking on why hospitals need to provide information therapy. Dr. Chatterjee, MD, is CEO of Dr. L.H.Hirandani Hospital since inception.
Good afternoon, ladies and gentlemen. Why hospitals need to provide information therapy, and some of you would feel that I'm grammatically incorrect. I ask a question and then I put an exclamation mark, but I do not want this to be a question. It is a fact that we need to provide information therapy in hospitals, and this is an area that we are lacking. For those of you who think that I have taken leave of my senses, I have not. I have not come here to give you a political harangue. But this particular gentleman was able to completely focus the country's attention to one particular subject. And I think such like meetings, ladies and gentlemen, would definitely focus the medical fraternity's attention to a very important aspect of medicines which we are missing. Nurses in our country have 5 rights: the right medicine, the right person, the right dose, the right route, and the right time. And for us, my tribe is just the prescription of the right information, the right person, and at the right time to help them make a decision. 5 that the nurses do, and we do not even do 3. Being a gynecologist, I've taken pictures of ladies. Please excuse my partiality, but how things stand today is that we have a new consumer, smart, articulate, well-read, and empowered. And if we do not give them an explanation or say that you may not understand, I think that it is insulting human intelligence. There are newer scientific therapy. There's plenty of information available on the net. We've just seen examples of that. But that's information, and as opposed to knowledge that doctors have. So therefore, we talk about stem cells, we talk about gene therapy, we talk about biological response modifiers, the newer medications which come into the field of cancer. Somebody asked a question of small cell carcinomas. Do they metastasize? And how you can change the response of small cells? Now that is what you could spend a little time with your patient with and help the patient understand. Imagine if somebody told me that we have robotics and we will do a keyhole surgery and they will hack into your insides. I would be petrified. But if somebody told me that the surgeon would be the person controlling everything and information has been pre-fed into the computer, I would be little secure. So therefore, these are things which are driving the need for information therapy in hospitals. The Quality Council of India, as has been very well put forth, is now accrediting hospitals. We were the first in Mumbai to have this accreditation. So therefore, the auditors actually go to patients and their relatives to find out, are you informed about what's happening? So, ladies and gentlemen, there will come a time where you will not get this accreditation if your patients are not singularly informed. And the Quality Council of India is working towards ensuring that information therapy is disseminated from hospitals. Now, I couldn't help but upload this engaging smile of Aniruddha and this warm hug that a patient gets. And it is such a confidence-building measure, but that's what it's all about. The patient should have confidence in you. Just smile and talk to the patient. Give them 5 minutes additional of your time. Maybe you will see one patient less, but it goes such a long way. Now, if you don't want this gentleman pointing a finger at you and say that you were responsible for not telling me what it's all about, then why don't you engage in these customer relationship tools? It's available for you. Why sit on your high horse? So therefore, if every other industry is using this to engage their patients, their clients to come back, and we in the hospitals want to sit on our high horse and say, you know, you don't know it all and you don't understand. But if you explain it to me, I will understand. But given this large mismatch between hospitals and the number of patients that we have this attitude is, okay, the devil may care. Where are you going to go? You're going to come back to me. Somebody did raise the question that there was something written on a case paper that I didn't be part of a study, and I was nervous whether would they treat me again or not. Wholly unfair. So therefore, the patient has the right to understand what is wrong with them, how the treatment is going to go forth, and this high-handed attitude towards patients must end. Now, we see and read in our newspapers on a daily basis that there are incidents of staff rudeness, and sometimes the patient has a shriek of agony. I've lost a relative, but I didn't understand what happened. So I turn violent. I abhor the fact that a patient strikes out at a doctor. It's not on. But can you control that shriek of agony? You cannot. But would it occur if the patient was singularly part of the team, the relatives were part of the team that were giving this care to the patient, and then the patient understood, the patient party understood that you're not God, and there were complications. And complications, there are more books written on complications in medicine than there are written about the disease. Resident doctors of 2 other Mumbai hospitals on Friday joined their counterparts at Sion hospitals who are on indefinite strike to protest against assault on their colleagues by a patient's skin, September 9, 2011. Not on, ladies and gentlemen, not on. So therefore, every professional should understand that when a patient comes to you, they come with trust. They don't need to go to the internet to log on, to be singularly well informed. Because they come to you and they trust you. They may be empowered, but don't turn them to the net. Speak to them. Because we, doctors, could be the starting point of information rendition, information therapy, which goes a long way to cure patients. I must conclude by quoting Henry Ford, one of the greatest business persons of our century. Coming together is a beginning. But we must keep this together. That's where we will progress. And then when we work together, we will succeed. And what will we succeed in is rendering quality healthcare to our patients, which all of us want to do, but sadly are misdirected, and it's woefully inadequate. So, ladies and gentlemen, thank you very much for your patient attention, and thank you for your time.